The 28th of October to the 1st of November will see the world observing Stroke Awareness Week. This period sees efforts aimed at raising awareness about stroke prevention, treatment and recovery amplified. Strokes are the second highest cause of disability and death in South Africa, often leaving survivors with lifelong complications. Dr. Karisha Quarrie, Clinical Directorate at Operations Manager at Life Healthcare, joins us now for more on this conversation. Dr. Karisha, thank you so much for your time this evening here in SABC News. As we step into tomorrow to observe, of course, Stroke Awareness Week. Maybe if you can just educate, the public when it comes to strokes. What is a stroke and what happens to a person's body when they do experience a stroke?
Bali, thank you and good evening to you and the viewers. A stroke is a lack of oxygen to the brain. So there's a blockage in the blood vessels by a blood clot, or else there's a damage to a blood vessel of the brain and there's hemorrhage into the brain. And what this results is in damage to the brain and usually it's one half of the brain, and that results in disability on the person's face and upper limbs and a disability in that area.
Also, maybe if you can just give us an insight when it comes to the sort of signs to look out for, when it comes to a stroke, and how does one identify that someone is indeed experiencing a stroke?
Yes, fortunately, the signs of stroke are easy to identify, and we can actually use the acronym BFAST to help us to remember what the signs of stroke are. And those, the B means a balance problem. So somebody you notice that somebody is not coordinated, they're not standing properly, or they fall down, or their arms are not working at the same. And then it is eyes. You'll notice that there will be a movement of the eyes, or they'll have blurred vision, or they complain that they cannot see in one or both eyes. Then they will have facial drooping, so one half of their face will appear to be drooped. Then they will have arm weakness, so they will not be able to raise one of their arms as high as the other. And then the S is for slurred speech. So the person is not able to speak as clearly and articulate themselves as well as they normally would. And then the T in BFAST means time. This is the time that you need to take the individual to the hospital, because time is brain. The longer a person stays with those symptoms, the more damage to the brain. So they have to get to the hospital as quickly as possible.
What causes a stroke?
So some of the associated diseases that contribute to stroke, is the main risk factor is hypertension. So having a high blood pressure. Almost 80% of people who suffer strokes have high blood pressure. Other risk factors include diabetes mellitus, or having high sugar levels, high cholesterol in the blood, any form of heart disease. And then other factors include having obesity, so having a high body mass index. People who smoke are also at high risk. People who have vascular diseases for whatever reason, genetic diseases, etc. And then people who have a sedentary life, so they don't exercise or have a good diet. These are all contributing risk factors to the development of a stroke.
And say, for instance, someone feels as if, they are having some sort of an attack, or, they're coming down with a stroke. What would be your advice to them? What should they immediately do?
So I think before we even get to what should you do when you're having a stroke, it's important to know that if you have those conditions that I previously mentioned, that you should have an awareness of, firstly, what the signs of stroke are. Secondly, which is your closest hospital that is accredited for stroke care. That means that the hospital has got doctors and therapists and nurses who are specifically trained in stroke care. And you'll notice that many hospitals have what we call stroke accreditation. So you want to identify that first. Then you want to educate your family members, especially young children, on the signs of stroke, because it's often young children who are with granny and grandpa in the afternoons after school who will pick up these signs and symptoms of stroke. So that's important. Raise the awareness in your environment. But when you see all of these signs, the balance problems, the blurred vision, the facial drooping, arm weakness, or slurred speech, immediately to go to hospital. And to ensure that you are assessed correctly by the doctors at the hospital, and that you also have some sort of rehabilitation plan upon discharge. That's really important.
And what are the long-term effects on a stroke should someone experience it?
The long-term effects, as you mentioned, Mpali, in the beginning, is stroke is the leading cause of disability in South Africa. Meaning that if you do not treat a stroke fast enough and rehabilitate an individual after they've had a stroke, then they can have long-term disablement, not able to function in their normal job. And what's really problematic about a stroke is that it's not only the muscles of the face and the arm that's affected, it's also the muscles in the neck, which makes swallowing really difficult. And because swallowing is difficult, people with stroke often will aspirate food, meaning that instead of the food going into the esophagus and the stomach, it actually goes into the lungs, which makes a person who has a stroke at a higher risk of developing pneumonias and lung infections, which increases their risk of death. So rehabilitation is really important to restore the function of somebody who has suffered a stroke and reduce their disability so they can have improved productivity and return to work or return to functioning as quickly and as efficiently as possible.
What can the public do, if anything, when it comes to trying to prevent a stroke? If, like you've mentioned, that these are the people who are at risk, is there anything that they can do to prevent a stroke from taking place?
Yes. So the first thing is, if you have any chronic medical conditions like high blood pressure or diabetes, then you need to take your medication. And then you also need to make sure that you have your annual checkups or your checkups at your hospital as required or with your doctor. Very important to continue to take your medication. Also important to quit smoking if you smoke, reduce alcohol intake, to start taking or having a healthy diet where you have fresh fruits and vegetables, increase your fluid intake to a level as prescribed by your doctor, and then also ensure that you exercise and go on a weight reduction plan if that is part of your risk factors. And then again, educate. Very, very important. And then again, to rehabilitate if you've had a stroke. Even if you've had a stroke 3 months ago in Bali, it's still important that you undergo some or other form of rehabilitation so that we know where you are and how we can improve that functioning in those muscles.
All right, Dr. Karisha, thank you so much for your time and for educating the public when it comes to stroke awareness. That is Dr. Karisha Quarrie. She is a clinical directorate operations manager at Life Healthcare. Of course, just giving us an insight when it comes to that awareness that will be starting from tomorrow until the 1st of November. And that is the Stroke Awareness Week that we will be observing.